there's a good chance I'm gonna lose my hair.
Previously on Birth Stories.
Obviously, as well, there's a possibility that I can lose my eyelashes and eyebrows. And that really scares me.
Last time I was on morphine and Demerol and Gravol, and it was pretty high doses, actually.
I don't know what the emotion is. I don't know what it is. I just know it hurts a lot. Like, but there's nothing I can do about it, you know, so I try not to dwell on it.
Am I interrupting? Hello. So what's this movie star?
21-year-old Lucy's obstetrician appointments aren't typical. Her pregnancy is high risk. She has a rare and life-threatening bone marrow disease that requires weekly blood transfusions and constant monitoring.
Pretty stable in terms of my blood.
So that's much better than when you were here, right? But as long as it stays at this level, then the likelihood of bleeding is low.
Mm-hmm. It does drop down somewhat, the hemoglobin she has, and that's with transfusions every week.
I understand
Yeah.
that.
When will we find out then the exact date of induction?
Just working on it.
Oh, okay.
Yes.
So we're booking the induction for 4 weeks from now. All right. So let's
Lucy's
go.
life is seeing one doctor after another. Since the father of Lucy's baby, her boyfriend of 3 years, abandoned Lucy early in her pregnancy, her mother has been at her side for each appointment.
Do you realize, though, that next time we go in, the 25th of October, to see him again, then you'll go the next week, and then I'll be having the baby.
Yeah.
Oh, are you ready, little guy? Oh, wow.
It's the third year recital. So it's more or less if I pass or fail my third year, and it was postponed until today because in April I was feeling the onset of sickness from the pregnancy, so there was no way I could at all perform. A little bit edgy now. I'll feel a little bit, maybe 2 minutes before I go on stage. That should be fun.
Warming up for a recital is Jennifer, a 23-year-old university student and an aspiring opera singer with a growing stage presence.
How's the breath?
Oh, it's wow, every day it seems harder to breathe.
Welcome to motherhood.
Oh, indeed.
Well, it makes breathing even more of a challenge than it regularly is. You know, singers always have to be reminded to breathe so deep, but when you got a baby there, you have to breathe beneath the baby, and it's a lot of work. It's even more work now. It's doing double time.
Chewing to make sure the jaw does not get involved.
Is that it?
Good.
Okay.
Super. Today we're at the spa at the Elmwood, and I am getting some much needed R&R, and it's probably the last time I'll be pampered for a little while.
Susie will soon give birth to her second child in 2 years. She has fibroids that cause excruciating pain, and her last pregnancy saw her hospitalized and on morphine. This time, she's coping better.
Something's been going on. Is probably going to happen soon. I'm surprised I actually made it to the spa. I didn't think I was going to make it for this visit. I haven't been sleeping well at night because of the baby's sideways, and it hurts. It hurts on both sides, actually, this side and that side, because of the head and the feet. So I'm tossing from side to side every half hour or so, and then in the middle of that, you're going to the washroom. And I have this one peculiar, there's an awful lot of pressure. But there's one spot that really hurts, and I'm sure there must be a fibroid there. Okay, comfortable? Uh-huh. Yeah. Anything specific today that's bothering you more than usual?
I guess low back pain is, and even between my shoulder blades, I've had some pain there as well.
Okay.
This will be it for a while, I'm sure, after the new baby comes. I think I'm gonna take you home.
In the audience is Jennifer's biggest fan, her husband Emilio. He too studied to be an opera singer, but fatherhood and a quick marriage in his early 20s forced a change of plans. Emilio's first marriage didn't last. Now Jennifer and Emilio are expecting a child and determined that Parenthood won't keep Jennifer from singing.
Good job, Jen.
Lost the voice.
Huh?
No, Ryan, we'll talk about it later.
That's okay.
Oh, well.
I couldn't do it.
I sung like a half an hour, and then by the time I got to the Italian, it was half an hour into straight singing. I couldn't sing anymore.
What's that one song? The one.
Yeah.
Isn't that a little faster done?
Yes, I was dying.
Did you guys plan that on purpose?
No.
Okay, Susie, if you want to lie back a sec.
Susie gets a regular checkup 3 weeks before her due date. Recently, the baby's position has been a problem, and Susie and Greg are worried about a difficult delivery.
Oh, something's going on.
Well, I just want to... Yeah, I guess you're right, actually.
I had to speak to the case room and to Dr. Ryan before we spoke, because I didn't want to make an offer that I couldn't back up. So the baby is head down, and the head is well down. Your cervix is about 3 centimeters dilated, and it's really nice and soft and thin and ready. So I think we should offer you induction today. Dr. Ryan, who you remember from here last time, he's staffing the labour ward for us today. So to me, the stars are aligned or whatever.
Okay, it's moving. I'm trying to keep it straight.
But
Okay.
it feels nicely down. I think it should be okay.
I think it's in.
Yeah,
Okay.
yeah. Do you want some time to think about it?
No.
No, it makes sense. I mean, it
I think
does
it does.
make
I
sense.
think it does. I think it does. I'm pretty pleased, optimistic that things will go well for you.
Okay.
Yeah, that's good.
All right.
You're gonna be happy.
Why?
I know the day.
You know the day they're going to do you?
Yeah.
What day's that?
I go in on the 6th, which is a Tuesday night.
Hanging over Lucy is the possibility that shortly after giving birth, she will need a bone marrow transplant, a risky procedure that includes chemotherapy. But her transplant doctor has some hopeful news.
Did you get a transfusion last week?
No.
You didn't?
No.
Ah,
What is it?
79.
It's holding well then.
So it's holding without transfusion.
Oh, good.
Wow.
Now, if you are getting better and we don't have to transplant and we see a major improvement after you've delivered, then we will know that perhaps there was an element of the pregnancy involved. If it happens once, does it happen again? Not necessarily. I don't think anything's going to happen. We're going to be following you, and if we see, for instance, drift one way or another, we can start planning. So it's not as if we need to make the decision today and do this next week.
Right.
I can't believe I'm at 79.
Neither can I. Why is it 79? You got your usual 1 unit since I saw you the last time, and then you tell me no. That's great.
You know, I never went to parties, things like that. I was always at home practicing, what have you. And I remember them just saying to me, well, how can you be seeing Emilio Fina? You're at university.
Jennifer was a shy 21-year-old from a very traditional Catholic family, and Emilio, 6 years older, was a divorced father of 2. Not what Jennifer's parents had in mind for their daughter.
But 2 years ago, I had tickets to an opera that somebody else had turned me down. I guess last minute back out. She found some sort of excuse, so.
It was fate.
It was fate, yeah. So I said, oh, it's okay, I'll find someone to go with. You know, they were front row tickets, whatever. And I called her up to go to the show. And she turned me down too.
I'd seen it the night before, so it's... But then we started talking more or less about, you know, I asked him what he was up to, and he's like, oh, well, my friends, you know, and I have been going salsa dancing all summer. Just learned how to Latin dance.
I jumped at that chance. I said, well, whenever you want to go out, I go out every night. I just took a chance one night. I said, listen, I don't know how you feel about me, but I feel like a school kid right now.
That was Halloween.
Yeah, and I said, I'm gonna ask you if I can kiss you, and you know, just tell me the truth. And
I was doing pirouettes all the way down the hall to my apartment that night. That was my first kiss.
yeah.
Yeah, that was October, and then the following August, yeah, we were married in Paris.
And of course, that didn't go over well with either of our parents.
It's not troublesome. I mean, I can tolerate
Well,
it.
it's 45 minutes, so there's not much solution there.
Susie is being induced. She's been placed on an oxytocin drip that will stimulate her labor pains. Because of her fibroids, Susie knows a lot about handling pain. She plans to have this baby as naturally as possible.
When I came in here on one of the many visits, she did say to me that she has seen women using the birthing ball, and apparently it helps with your perineum. That's how you say it, right? It helps not stretch, but just massage your perineum. So that's what I'm hoping to achieve here. I'm not contracting as strongly as they'd like me to be, so they're just increase the pitocin or oxytocin. Okay. Yeah, it's starting to hurt now. I'm starting to get uncomfortable.
It's really frustrating because you know, you're prepared for one thing, and then it's like, oh, well, is it going to be? Is it not going to be?
The transplant doctor has given Lucy new hope, but also the frustration of more uncertainty.
You know, I want actual details. I want to know a game plan, not let's see how it goes, because
Sometimes, sweetheart, that's all you get. You can't always have a game plan. They have a vague idea, and then they just have to see
I know.
how...
See, it's funny because I was like that at the beginning. When they couldn't diagnose it, I was fine with it. And you remember the desperation that you needed to know? Well, this is how I am now. I feel like I need more than just, I don't know, we'll see how it goes. I mean, mentally, it's a big thing to...
I'll say.
So you need to go with some kind of... Hi. Oh, hi.
How are you feeling?
Oh, not that great. I think I have an infection.
Okay, why do you think that?
My throat is... I woke up with it yesterday. Really, really sore.
Say
All
right, that's not too bad. One more time.
Okay. You're 77 today, so you're going to need a transfusion.
Yeah.
Okay.
The reason why last week, I was feeling fine. So I canceled it on my usual Friday here because I knew I wouldn't be below 70, but don't have as much energy as I've had previous weeks, so.
You're a little bit tired. We'll go ahead and give you the transfusion. Okay. Okay. Anything else I should look into? Anything else? How's she eating?
Mostly pretty well.
Take a look at my weight. I'm eating very well.
After their elopement in Paris, many months passed before Jennifer saw her parents. But eventually, their new son-in-law, Emilio, broke the ice, and thoughts of a grandchild melted their hearts.
I always did think, you know, God saved me for him. Like, he seemed to protect me. I never had any boyfriends throughout high school. I never went out gallivanting, as your father would say, in high school, university, nothing. And I always used to wonder, well, what's wrong with me? Why can't I, you know, meet somebody who's like Emilio Fina, whom I wasn't, you know, allowed to love? And
on the other part of that, in a way, not in a way, I know without a doubt that I had to go through absolutely every single turmoil and problem in my life in order to be worthy for you. But raising two children, I mean, it was like night and day that it just turned me into, I feel as though it turned me into a man.
I will have an order of the short stack chocolate chip pancakes and home fries, please.
Okay. And can I have the eggs Benedict with pea meal, please?
Pea meal Benedict?
But really easy on the sauce. Okay.
Lucy's favorite pancake house has become a weekly habit, keeping her spirits up before she faces another blood transfusion.
So what I want to know, I want to ask you, what colour is the blood going to be today? Red or brown?
It's the iron. It's the actual iron. How much iron is in the blood. But how many donors is it in one unit? So if it's one donor per unit.
You've got a lot of donors. And you know what? Aren't you glad that people did it?
But you know what's sad is that a lot of people don't realize and don't think about it until it's needed.
And that's why I'm always so grateful that we did give blood. Because when I think that, I mean, that's the only reason that you're alive, that those people gave blood and you can have it every week. It's a really... And so if they hadn't given it, we mightn't have had you. And it's a horrible thought. So...
Well, it's going to change Jennifer a lot. It'll be a lot different. Like, what were we saying on the way home from church yesterday? What I was saying, well, Jen, we're not going to be going out dancing anymore. We're not going to be doing this as much. Nope, I don't believe it. I don't believe it.
My sister's already offered to take the baby away for 3 days if we wanted to go dancing. She's playing.
Like, we will go out, but it's not going to be...
That is going to be different. The baby's going to be
twice
priority.
a week, and you can't.
I want you to push with your legs. I want you to push down.
Okay, let go of the nitrous, Susie.
No, I want the nitrous.
I know, but if you've got to push, okay?
Put your hands back.
Susie's got her 2 older children and husband Greg at her side. Greg stayed home to take care of Susie throughout the pregnancy, and now he's eager to help in the delivery too.
Right here? I can see ahead. That's it, honey. Take pictures, Jess.
It's coming, Susie. You're doing really well.
It's like beautiful, beautiful,
Okay.
honey.
And the other hand you're just going to use on top there. Okay. And another little cough. And we're just delivering the shoulder. So there comes the shoulder. So now we lift up.
Yay! Hi. Hi, little girl. Hi, little girl.
Okay. Now, are you going to cut the cord first, Mom? You want to cut the cord?
Yeah. In between the two? In between the two.
There you go.
Okay.
And you get there.
Okay. Watch out, Susan. Sorry, miss. Look what you've got here. Oh. Sorry. You know what? I'm famous for dropping babies, honey. Right?
So what's the name? Matisse. Chloe. Tissot.
Hi, Matisse.
Hi, sweetie.
Hi.
Was that hard on you?
Huh?
Was that a lot of work for you?
I just came up to pick up my marks for the recital.
Okay, those are great.
Perfect.
And those are the comments. Would you like a copy of that?
I would love a copy of that, if that's all right.
Lily, can you just make a copy of these? Please save this copy.
Pretty well. Well, better than I expected. Hi.
Marks?
Oh, yeah. What year was I born in?
78.
That's what I got.
Oh, that's good.
That's really good.
That's honors, eh?
That's, yeah, 78 is very good.
Excellent.
So I'm impressed with that.
Hi, gooey little girl. Hi, world. Hi. Can I kiss the gooey forehead? Of course you do. Hi. Say hi, world.
Hi, Matisse.
Did I catch you okay?
She's listening so attentively.
Oh, yeah.
I don't know who she looks like. Oh, Greg is a postman.
I was gonna say that, but I'm like, maybe I shouldn't.
Yeah. You've got super mailbox. I'm not concerned. There we go. Beautiful. Thanks, guys. Thanks, Jess. Thank you, miss.
He wants to eat. Okay, here you go.
Just gonna give you some Benadryl.
Oh, can I ask you a favor first? Can I have my blood pressure checked before? Because the Benadryl always makes it go lower. So I want to know what it would be.
Before and after.
Exactly.
Okay.
Thanks. Yeah, it's still... Look at my
147 over 94.
Oh, that's really high.
High for you.
Yeah, he told me if it's anything above 140 over 80. My pulse is 128. Heart attack city here. I'm in the right place.
Lucy is A positive, receiving A positive.
No comments.
Lucy gets prepped for another blood transfusion, wondering what will happen in the weeks ahead. Now she has one more thing to worry about, her blood pressure.
And there we go. So about an hour and a half.
Great, thank you.
Next time on Birth Stories.
Fabulous. Beautiful one.
I want to look sexy too, not just the claw. I thought he would see the respect and the dignity and the honor that I had for, you know, for him and I. It's our baby, it's not just mine.
Well, of course, the doctor said not to be concerned, but they said. So, makes me a little concerned, obviously.
I don't think anything's gonna happen, but I mean, realistically, they don't know, you know.